We wanted it to be a friendly, inviting building, not scary like many hospitals are, built more like a hotel than a hospital, and we tried very hard to achieve that.
To work in the Queen's Centre is, the staff do go above and beyond. You do have to be a special type of nurse.
It's a very, very friendly environment. There's a lot of good people here to work with.
And I didn't realise when I came here about all the beautiful areas around Hull as well, the excellent kind of countryside and the beaches and things. So I say it was a bit of an eye-opener for me.
It was perfectly possible to live in some of the surrounding villages, which are a really nice place to be, without having the compromises of, say, city centre living or a long commute, but still having the benefits of being near a big city where you can get everything that you might want. Even just walking across the Humber Bridge, and that's something we do every New Year's Day, and it's a really nice way to blow the cobwebs away. You can feel that as a doctor you're doing quite a lot of good and you're making a difference. In the space of a few months you can see almost every different disease known in haematology, which is just really interesting.
The reality is that over the course of the life of this building, every person in the locality will use it either as a patient or as a relative.
The building is an award-winning building and it's just a really lovely place to work. The great thing about this place is the people who work here. And that's obviously, it's really important that you have good colleagues, and I can honestly say that all my colleagues are excellent. And it's one of the friendliest departments I think you could ever work in.
I find oncology a real privilege to work with patients who are maybe at the end of their life or receiving treatment for some terrible disease. And I think it's a real privilege to make that difference. I think that's the nice thing about oncology.
We have an excellent radiotherapy department, really very innovative, some world-class facilities. We're one of the 4 contact radiotherapy centres in the UK, and certainly I say as a consequence of that, Hull's become renowned in the worldwide field in rectal cancer, so we've done some really exciting things down here.
So you should always be able to see outside whenever you're being treated here, so there aren't any places where patients are where they can't see a view either into the outer landscape or into the beautiful courtyards that we developed here. And we put a lot of art into the building as well. We worked with an artist all the way through the development so that became part of the building.
The schools generally are pretty good. There's a good variety of quality primary schools within most of the West Hull villages. There are some good state-led secondary schools, and there's a variety of different independent schools which have got good reputations and academic attainment.
It's a great place to come to if you want to live and build a career, because you can afford a lot more for your money as a consultant here than you can in many other places in the country.
And being just on the edge of Hull, it's quite easy to get in and out of. I've been as happy here as I have been in any other hospital I've ever worked in.
Quality of life that you can have down here is really amazing.
I wouldn't want to be anywhere else now, and my children who've had to move to other parts of the country for work and everything else, I really would like to come back.